Cast is now starting. All attendees are in listen-only mode.
Good afternoon. Thank you so much for joining us today. My name is Tamara Bingham-Noyes. I'm the Director of Business Development here at Center for Change. I wish that I could see you and you could see me, but my webcam is not working today, but everything else is. And so we're grateful for that. So you just get to hear my voice for the introduction today, but you'll get to see Heather and her presentation. So Dr. Finley will tell more about herself when we turn the time over to her, but we have a couple of things that we need to go over really quickly regarding just some items that you need to know about as we move forward with the presentation. So a copy of the PowerPoint is in the handout section of the toolbar. You're welcome to access that if you'd like. You can download it and print it out later if you choose. And of course, you can go along with Heather as she presents her PowerPoint on the screen. A copy of the post test is also in the handout section of the toolbar. This is for reference only because in order to obtain CE credit, you must take the online post test. And I'll talk about that in just a minute. But you're welcome to reference the post test that's in the handouts sections as Dr. Finley goes through her presentation so you can keep an eye on the test questions that may come up. You're welcome to submit questions in the questions section of the toolbar. We'll try to get to a few questions at the end of the webinar. Heather will stop a few minutes early and we'll address as many questions as we can, recognizing that the majority of you are clinicians and likely have to hop off right at the top of the hour. So we want to be respectful of that, and we'll do the best that we can to finish on time and still address some questions at the end. When the webinar ends, as soon as I click the button for it to stop, then there'll be an evaluation that will pop up on your screen. That's an evaluation about the webinar itself, and it's a CE requirement for us. It's completely anonymous, so feel free to be candid in that evaluation, but we then tabulate that information and send it to the CE entities. So if you take 30 seconds to fill that out, when it pops up on your screen at the end of the webinar, that would be great. And then about an hour after the webinar ends, you'll receive a separate email from GoToWebinar with the link to take the online post test. So you must take the post test online and pass it in order to receive continuing education credit. If you don't see well, let me back up. The certificate, once you pass, the certificate will automatically be downloaded to your computer. If you don't see it, please look in your downloads file on your computer. It should be there. If you have any trouble, feel free to email me at the email that's in the emails that you got to confirm your registration. So it's cfcwebinar@gmail.com. You're welcome to email me. If you are listening or watching on your phone or your iPad, sometimes that test doesn't work. So feel free to email me if it doesn't work, and I'll send you a different link to use. So I think that's it for the information that you need prior to starting. So I'm going to turn this over to Heather. So hang tight while I do that. Heather, it's coming to you.
Okay. All right. I'm going to turn my webcam on too. Hopefully you guys can see me. It is weird to be giving a presentation when you can't see everyone else, but thank you guys so much for spending your afternoon or an hour of your afternoon with me. I am so excited to be here, and I'm very excited about this series. So in case you were unaware, this webinar is actually a part of 4 webinars that are going to be going in depth over the gut brain and how that relates to our clients. So today is going to be a lot of science and a lot of background on the gut brain and just digestion and a lot of anatomy and physiology. So hang tight on this. We're setting the stage for a lot of the things that we're going to cover in the next 3 webinars. So super excited that you guys are here. Really excited to share this information with you. Definitely ask questions if you have them. I will do my best to not chat your ear off and leave time for questions at the end. And I will also take a look at the questions and make sure that I address them in the next webinars as well. So definitely make sure you register for those, and it'll be a fun time together. So let's get started. So we are going to be talking about the gut brain today, and just want to introduce myself first. So my name is Dr. Heather Finley. I am a registered dietitian. My doctorate is in clinical nutrition, and I have experience in clinical settings, outpatient treatment, and now a solely virtual private practice. I had the pleasure of, in the past, working for Center for Change, and I'm grateful that they still allow me to hang out sometimes. I am a gut health expert. I focused my doctorate training on gut-related research. I've had my own personal experience with digestive issues, and I know that many of you treat clients with digestive issues as well. So I'm hoping that this provides you some very applicable knowledge in order to help them on their journeys. All right, so today we are going to talk first about digestion and absorption. Next, we are going to talk about dysbiosis. And then lastly, we're going to talk a little bit about IBS and eating disorders. And this will continue to be the flow throughout the rest of the webinars. All right, so first, I want to talk a little bit about the digestive tract. So your digestive tract starts here in your mouth and ends all the way in your booty, where everything comes out. So your digestive tract is a series of organs joined by a lot of different pathways from your mouth to your anus. There are hollow organs that transport and process food, like your stomach, your small intestine, and your large intestine. And then you also have some solid organs that aid in breaking this food down. So that would be things like your liver, your pancreas, and your gallbladder. And we'll learn throughout our time together that there are a lot of different steps in the digestive process, and there are a lot of different reasons why your clients may present with digestive concerns. And then we'll also learn too how this affects the gut-brain connection and how and why that is applicable to the clients that you're working with. Okay, so just an overview of the digestive process. Digestion really starts in the mouth. I think oftentimes people think that digestion starts when everything hits your stomach, but really digestion starts in your mouth, and maybe even before that. So I'm sure all of you have had an experience where you walk by a bakery or a restaurant and the food smells really good and you start salivating. So your body is producing saliva in preparation for breaking down food. And then when you eat food, you start chewing it. This is what's called mechanical digestion. So you're chewing food, mechanically breaking it down so that it's easier for the rest of the organs to do their job. After this, food enters the stomach. Stomach acid and enzymes break down food and protein, and then it ends up in the small intestine. The small intestine is where you absorb a lot of the nutrients from your food, and it is where a lot of times people will experience bacterial overgrowth, also known as SIBO, which we'll talk about later, and that can affect the absorption of the food that you're eating and the nutrients that you're getting from food. Then lastly, you are assimilating nutrients and excreting them. So these digested nutrients go throughout your body to do what they need to do, deliver nutrients to all the different processes that need what is broken down. and then you excrete waste out of your body. So we'll talk also about some key players. These are a lot of the, or all the organs that are involved with digestion. So I want to go through each of them, what their purpose is and what they do, and what can happen often when things are disrupted. So first we will start with the mouth. The mouth, like I mentioned, is the first stop in the digestive process. Chewing mashes your food and it makes digestion easier later on. So the example I like to give is, let's say you are eating a large piece of chicken. If you mash this food down with your teeth really well, it's going to be a lot easier for the stomach, small intestine, large intestine to utilize this versus if you try to swallow a very large piece of chicken without chewing it. So chewing is often undervalued as a part of the digestive process in that it really does make things easier later on. In your mouth, you have digestive enzymes like amylase, and they start breaking your food down. So these enzymes go in, they start breaking the food down that you're eating, and they get it ready to be used later on. Eating speed does impact digestion. So one of the first ways in which people can develop digestive symptoms after eating, so something like bloating, maybe getting gas, maybe constipation, is actually at the speed at which they eat. If you're eating very quickly, you're not chewing your food very well, this is going to affect how your body digests and absorbs your food. In terms of an eating disorder, this portion can be really challenging for clients. So how many of you, I wish I could see by show of hands, but just think, how often do you talk to your clients about how they're eating, in addition to maybe what they're eating? But this is very powerful. So if you have clients that are very disconnected from their food, food adds a lot of anxiety, they're trying to rush through a meal because they get it over with, or if they're trying to distract themselves, they may not be chewing their food very well, and that makes it harder on digestion, which we'll see later on how that can actually affect the symptoms that they're having. So sometimes clients get gas, bloating, constipation as a result of their eating disorder, and the digestion that starts in the mouth can be part of this. So talking to your clients about how they're eating, trying to chew their food really well, trying to mechanically digest the food, because I know that many times you'll hear clients say, well, my stomach hurts after I eat, or I feel like food just sits in my stomach. This is one way that you can help them with the symptoms that they're having as a result of eating. Next up, I want to talk about the vagus nerve. So the vagus nerve is a superhighway between the gut and the brain. And this is a bidirectional pathway. Your gut talks to your brain and your brain talks to your gut. This also dictates the rest and digest mode and the fight or flight mode, which in the second webinar, we will be digging into a lot more. But your vagus nerve is super powerful as a part of the digestive process and a part of the gut-brain connection. This nerve tells the muscles of the stomach to contract so that you can move food and waste through your system. It helps to push food into the small intestine so that food can be absorbed. And stimulation of the vagus nerve helps with gut motility. So how many of your clients struggle with constipation or complain about being super bloated after meals? Sometimes this can be connected to the vagus nerve. And oddly enough, you can stimulate your vagus nerve by gargling, humming or singing. So one tip that I often give to my clients is to sing or hum happy birthday twice in order to stimulate their vagus nerve, to get themselves ready to eat and help get their digestive juices flowing, to help ease some of the symptoms that they're having on a digestive level when they do eat. So like I said, we'll talk about the vagus nerve more in later webinars because the vagus nerve really is so key here as far as the gut-brain connection, because it's what connects them. And there's so much research now about this that I'm excited to share with you. Okay, next up is the stomach. So your stomach is where you have hydrochloric acid, and this hydrochloric acid and peptic enzymes, they soften hard vegetable skins and protein. They actually kill any bacteria that is entering through the nose or the mouth. And it takes 1 to 5 hours for a medium-sized dinner to get digested. This digestion then empties food into the small intestine. And I'm going to share more about this in a couple slides, but low stomach acid is very common with disordered eating. Low stomach acid can look like feeling very full after meals, feeling like food sits in your stomach like a brick, and oftentimes just addressing the stomach acid piece can make these digestive symptoms that your clients are having so much better, because as you know, when clients are struggling with an eating disorder or disordered eating, food is not something that they necessarily look forward to. Mealtime can be extremely stressful, and then coupled with digestive symptoms, that doesn't help. So we often get into this chicken or egg scenario with a lot of these symptoms that they're having. But if you can help to ease the digestive symptoms that they're having, it can decrease stress around mealtime. I've seen this with a lot of my clients, just feeling more comfortable after eating, not feeling so full, not feeling like food is just sitting there, not going anywhere. And like I mentioned earlier, with the vagus nerve, stimulating the vagus nerve through humming or singing or gargling, this can really help actually to improve stomach acid levels and gut motility. So that's a great way to do that. There are other things that you can do, which I'll share in a second. Okay, next is the pancreas. So your pancreas is your main workhorse for producing digestive enzymes. Digestive enzymes help you to further break down your food. They break down the 3 macronutrients: carbohydrates, proteins, and fats. And it also is responsible for hormones that help with blood sugar balance. Lipase is the main digestive enzyme that helps you to digest fat. Protease helps you to digest protein, and then amylase digests carbohydrates. So these are extremely important for the digestive process, because if your pancreas is not working properly, it can be very hard to break down these macronutrients so that your body can use them and assimilate these nutrients. Okay, next up is the liver. Your liver is your body's sewage system. Your liver filters your blood, it removes toxins, it helps to metabolize drugs, it regulates hormones, and it creates bile for delivery to the gallbladder. Bile is very, very important for digesting fat, and the liver helps to process nutrients from the small intestine. The liver itself performs over 500 functions in the body, and oftentimes there are some issues with liver detoxification, which we'll get into a little bit later. But your liver is an extremely important part of the digestive process, and this could be a whole nother webinar in itself, but especially with co-occurring eating disorder and substance abuse and the effects on the liver, and then down the road, how that affects digestion and how that affects just detoxification of the body. And I'm not talking about detoxification like a juice cleanse, just your body's natural detoxification process in removing waste in your body. Okay, next up is the gallbladder. So like I mentioned, the gallbladder and the liver work hand in hand together. The gallbladder sits just under the liver and it delivers bile to the small intestine. Like I mentioned, bile is extremely important for digesting fat, and without a gallbladder, this can impact fat digestion. So there is a really high incidence of SIBO, or small intestinal bacterial overgrowth, with gallbladder removal. And gallbladder removal is a super common procedure that a lot of people have. And as a result, oftentimes people will get digestive issues. And then sometimes we end up in this chicken or egg scenario. Was it the digestive issues that caused the eating disorder, or the eating disorder that caused the digestive issues? In that case, sometimes getting these digestive issues can result in disordered eating because of the symptoms that they're experiencing as a result of bile flow not being adequate and helping them to digest fat. So we'll get into that later as well. Next up, the small intestine. So this is the longest leg of the digestive process. You have over 20 feet of intestines, and this is where your major food groups are broken down. After your food groups are digested, we get amino acids, sugars, and fatty acids that your body can then utilize. These are then absorbed into the bloodstream, and in general, it takes about 2 to 4 hours for a meal to be processed in your small intestines. However, a lot of our clients struggle with slow gut motility and slow digestion as a result of disordered eating or their eating disorder. And this is where constipation can occur, and clients tend to feel like their intestines are full, and in a lot of cases they are, because their gut function is affected as a result of either under-eating or any of the disordered eating behaviors that they're using. And so the small intestine can be a piece of this, and working on digestive balance, which we will continue to talk about, can be really helpful in helping your clients to not have these digestive symptoms that then make it even harder for them to eat what they need to in order to recover. All right. Next up, the large intestine. So your large intestines, it seems kind of backwards that the small intestine is 20 feet long and the large intestine is only 5 feet long, but that's what it is. So your large intestines are 5 feet long. Water is absorbed from the remaining food matter. Excess waste is then removed from the body. And we'll talk about this a lot, but this is where our gut bacteria live. So everyone has about 2 to 5 pounds of gut bacteria. And these bacteria in the gut feast off undigested fiber from the food that we eat. And then these fiber that we eat produce postbiotics, which I'll talk about a lot, and how beneficial they are to mental health and digestive health. But these postbiotics, also known as short-chain fatty acids, are extremely helpful to the body, for the brain, and so many other things. And so your large intestines, where your gut bacteria live, is the last step. This is where your gut bacteria are, and they feast off of these fibers that haven't been digested from any of the other processes, because they are fiber and your body can't digest them. So they're feeding these gut bacteria, and then these gut bacteria pay you back with these short-chain fatty acids. So that's a little sneak peek into what's going on every time you eat a meal. It's a very complicated process. There's a lot of different pieces to it, And there's a lot of ways where digestion can go wrong. So it's important to really understand how digestion works in order to have a clear picture when you're working with these clients on how you can help them, because it's usually not so cut and dry. So the first reason for poor digestion, improper chewing. So you can see this visual here. If you're not chewing very well, you're not breaking your food down in a way that makes it easier for your body to digest, that is one way in which digestion can go wrong. The next is stomach acid. I know I mentioned earlier that this can be really common with our clients, and I'll explain more in a second. So this is another way that digestion can go wrong. Next is poor pancreatic enzyme output. If your body is not producing the enzymes necessary to digest your food, then this can be another reason. And then lastly, bile insufficiency. Like I mentioned, gallbladder removal can be a part of that. Liver function can be a part of that as well. So there are a lot of reasons why someone could be having digestive symptoms. Someone could be having the feeling of food sitting in their stomach, IBS-related symptoms, and we'll keep digging into this. So before we get to that, I want to explain to you a little bit more about the microbiome. So there's still so much that we don't know about the microbiome, but in the last several years, there's a lot that we do. And so I'm super excited because I feel like every day we're learning more and more about the microbiome, how it affects your gut, how it affects the brain, how it affects overall health, and just how everything is so connected. So your microbiome is 100 trillion cells of bacteria that line the mucosal membranes of your mouth, your skin, and your gut. So the one thing that I want to differentiate between is your microbiome is not just referring to your gut. When we are talking about the microbiome, we're talking about all the bacteria that is in and on your body. When we're talking about the gut specifically, that would be referred to as the gut microbiota. And your gut in itself has, like I mentioned, 2 to 5 pounds of bacteria. And these bacteria do so much for us. They help us to digest food that we're eating. They help reduce inflammation in the body. They improve mental health, and we'll keep digging into that. But we know that a healthy microbiome can equate to ample amounts of neurotransmitters. And when you're treating someone with depression, anxiety, any mood disorder, now this is being linked back to the gut and how the gut-brain connection is a player in this. So you may have heard the term psychobiotics. These are bacteria that specifically impact the brain, and the research on them is so interesting. If you want to go down a rabbit hole one day, you can do that. But from birth, our microbiome starts to develop. So the second that you come out of the vaginal canal, if you were a vaginal delivery, your microbiome starts to develop. If you were a C-section, your microbiome still starts to develop that way, but you're not exposed to the bacteria in the vaginal canal. And there is some interesting research about the different composition of gut bacteria in children born either way. Also another rabbit trail that you can go down, which we won't really be talking much about. So the term dysbiosis, I wanted to define this because I will be using this term a lot, and it's helpful to have context about this. So dysbiosis refers to the state in which bad or pathogenic strains of bacteria take over. So this 2 to 5 pounds of bacteria that you have in your gut, most of it in a lot of cases is good bacteria. However, oftentimes you can have bad or overgrown bacteria, and sometimes you can get into a state where the bad guys outweigh the good guys. And this is often when clients end up with digestive symptoms, and not even clients. It could be you, or it could be a family member. Now they're linking dysbiosis to so many other conditions. And like I said, there's still so much that we need to know, but the research on this is so interesting. So there's a lot of things that can cause this overgrowth of bad or good bacteria. So when the bad takes over, it can actually be linked to stress. So how many of your clients are stressed? It can be linked to drug interactions. It can be linked to a low fiber diet. So when I was explaining digestion and I talked about the large intestine, when a client is not eating enough fiber, maybe from the food restrictions that they have, or maybe because of the digestive symptoms that they have, and restricting food as a result, this can affect bacterial balance. Just like we need food for survival, so do these gut bugs, and they feast on fiber. So when a client has a restrictive diet or a low fiber diet, this can affect bacterial balance in the body. Lack of exercise or too much exercise can affect dysbiosis. Antibiotics can affect bacterial balance. They go in and take out not only the bad, but also the good. Alcohol can have effect on dysbiosis, birth control, and then, like I mentioned earlier, route of birth. And this is just a very short list of a lot of ways that this can occur, but the most likely relevant to the clients that you are working with. Okay, so why do these bacteria matter? One, they reduce inflammation in the body. Two, they regulate immune and digestive function. Your bacteria help you to digest food, and therefore, number three, enhance nutrient absorption. So get the benefit of the amazing food that you're eating. And then lastly, they help to produce serotonin and other mood stabilizers and neurotransmitters. There are hundreds of reasons why these bacteria matter, but simply put, here are 4 of the top reasons why the bacteria matter. So here's the process. So when you eat prebiotic fiber, or also known as soluble fiber, your gut microbiota, especially the probiotic bacteria in your gut, feast on this fiber, and they then produce end products called short-chain fatty acids right here. These short-chain fatty acids actually drop the pH of the intestines and then produce a lot of the health benefits in the colon and then beyond. So a lot of the gut research now is showing how the fiber really is the first step. So I think there's a lot of disconnect. Oftentimes people think, oh, well, I have a stomach ache, or I'm having constipation or diarrhea or whatever it is, you should take a probiotic. But sometimes you have to go a step before that and think, okay, what prebiotic fibers in my diet am I feeding to these gut bacteria? Because like I mentioned, the good gut bugs need fiber to survive. So maybe you've recommended a probiotic to your clients. Definitely not a bad recommendation, but you want to make sure that their diet can support this probiotic maintaining in their intestines. If they are on an ultra restrictive diet, they're not eating any carbohydrates, which are the foods that have fiber in them, it might be worth working on adding those things in first, so when they do add in a probiotic, it will actually stay alive in their digestive tract. There are products that have both, but sometimes we get a little bit ahead of ourselves. So I want to talk about something called the migrating motor complex. And if you were on the webinar in August that I did, I talked a little bit about this. So I apologize if this is a repeat, but it's really important. So the migrating motor complex is your intestinal cleanup crew. So this intestinal cleanup crew helps to go in and sweep out the intestines in between meals. And I often describe it like the after office hours cleanup crew. So they come in, they vacuum, they take out the trash, they might wipe down the countertops. This is exactly what the migrating motor complex is. So it's the dishwasher of the intestines. It clears out undigested food. And this motor complex kicks in about 3 hours after eating. So if you've ever had that noisy, gurgly feeling, you're sitting in the middle of a meeting and your stomach growls, this is what the migrating motor complex is. It's whooshing fluid through your digestive tract and clearing things out. This complex needs to clean multiple times a day because we eat multiple times a day. So fluid needs to go through and clear stuff out so you can then have a bowel movement. This greatly impacts constipation and gut function. And this is very relevant to the clients that you work with because a lot of them have constipation and a lot of them have digestive issues. So I want to talk about what can cause this system to malfunction. One is stress, two is lack of sleep, the other is grazing. Number 4 is gut-brain connection, 5, pain meds and opioids, and then 6 is food poisoning. So I'll go into depth a little bit more about these. So when your body is in a fight or flight state, and we will talk a lot about this in a webinar too, but when your body's in a fight or flight state, it is not worried about digesting and absorbing food. It's worried about being chased by a bear. So if you or your clients are constantly stressed, whether it's stress about food, whether it's stress about work, stress about being in traffic, whatever it is, your body is not thinking that it needs to digest food. It's sending blood to the muscles so you can run away from this bear. So one way to improve this intestinal cleanup crew and therefore improve digestive symptoms is working on stress reduction, which I know we all do with our clients. The next is lack of sleep, and similarly to stress, when you are not rested, your cortisol levels can be higher. This is a stress hormone, and that can affect this migrating motor complex. With grazing, so a little personal story here. When I had digestive issues, like I mentioned at the beginning, I had digestive issues literally for 20 years of my life. I often thought that in order to manage the bloat that I was experiencing, that sometimes was very debilitating and painful, I thought that I should just eat small amounts every hour or so in order to avoid it. What I didn't realize is that was actually making it worse because this cleanup crew was never showing up because there was never enough time in between the meals that I was eating to help whoosh fluid through and clear out my intestines. So the thing that I thought I was doing in order to help my symptoms was actually making it worse. The other piece is the gut-brain connection. So just like when you're stressed and your body thinks it's being chased by a bear, this can affect the gut-brain connection because it affects the vagus nerve. So if your vagus nerve is sending signals from your brain to your gut that there's an alert, then it can shut down digestive function because you're not worried about having a meal at that moment or digesting. So an example of this would be maybe if you're giving a big speech or you have a big meeting and you find yourself really nervous and running to the bathroom right before, that is an example of a gut-brain reaction or a gut instinct reaction. Your brain is saying, hey, don't worry about that, just get rid of it. We need to worry about this really stressful thing that we have coming up. And then food poisoning. So food poisoning is a very missed piece of this. Sometimes people get food poisoning and they don't know it, but when you have food poisoning, this actually affects the nerves that are responsible for gut motility. And this nerve damage can cause gut motility to slow down and therefore create more constipation in a patient. So something you may want to ask your patients if they're really struggling with digestive symptoms is, one, are you eating regular spaced out meals throughout the day, meals that are satisfying and leave you full for a little bit in between? And do you have a history of food poisoning? You'll be surprised how many people can say, yes, I got really sick this one time and I've never been the same since. So food poisoning can definitely affect the migrating motor complex. And there's some interesting research actually about how to improve the damage to the nerves from food poisoning, which we can talk about at some point as well. So I want to talk about the first piece of digestion, which is stomach acid or HCl. So like I mentioned, you chew your food, you mechanically break it down, and then your stomach gets this food. Your stomach should be super acidic, where this acid starts to break down food, it kills bacteria. This helps to enhance the absorption of calcium and iron and zinc, magnesium and copper. This decreases the risk of osteoporosis. It's super important for B12 absorption, and you actually need adequate thyroid hormone for production. So I know for me, a lot of my clients have co-occurring things. They might have disordered eating or an eating disorder, as well as hypothyroidism or maybe digestive issues. And it's easy to put these things in buckets and think that they're separate, but the reality is that they all go together. A lot of our clients have reflux as well. So we often think that they have too much stomach acid, but I would argue that most of the time clients have low acid, not high stomach acid. And as a result, their stomach is pushing this food back up because there's not enough acid to digest it and giving them symptoms of acid reflux. And it could actually be the low stomach acid that they're having. So then we think about how this can affect the other things that a lot of our clients experience. So many of them do have bone loss or osteopenia or osteoporosis. Many of them have anxiety, and B12 is extremely important for anxiety. Many of them have hypothyroidism as a result of chronically undereating. And so all these things really do go together, and it's important to have the full picture, because if it is that they don't have enough stomach acid, addressing this by either taking HCl or working on the vagus nerve connection, working on reducing stress can make a huge difference. So some signs of low stomach acid. Weak and peeling fingers is a sign of low stomach acid. As I've mentioned a couple times, feeling like food sits in your stomach like a brick. Iron deficiency is very common with low stomach acid. Undigested food in your stool, besides seeing like corn, any other food that you would see in your stool. Having chronic intestinal infections, your stomach needs to be acidic enough to fight off any infections or bacteria that may come into your stomach. If you're feeling really bloated right after eating, a lot of gas can be a sign of low stomach acid. Dilated capillaries in your face, and then burping right after meals. So a lot of these might seem like things that your clients complain of. So looking at stomach acid by just assessing, do they have a lot of these symptoms, and maybe working with someone to help you address this could be really helpful for, one, helping prevent other things down the road, as well as helping make it more comfortable for them to eat, so that then they're not scared to eat as well because of the digestive symptoms that they're getting. So here are some causes of low stomach acid. Proton pump inhibitors, aging, unfortunately, just as we age, our stomach acid decreases. autoimmune disease, hypothyroidism, like I mentioned, stress, honestly, the biggest one, fasting for too long. Your body likes to have consistent meal times. And I know that this is something that you work on with your clients, but if your clients are going long periods of time without eating, and then in some cases maybe binging and overeating at one point, this can definitely affect stomach acid because your body's confused. Do I need no stomach acid because I'm not getting any food? Do I need a lot of stomach acid? So having predictability of meals can help improve stomach acid levels. Viral infections can affect stomach acid, bacterial infections, and then H. pylori as well. So the biggest thing to start if you suspect that maybe a client has low stomach acid is actually working on that vagus nerve connection, working on the rest and digest state, maybe having your client take a couple really deep breaths before meals, or gargle, that could help. But just getting into a relaxed state before eating can make a huge difference. Working on meal timing and meal consistency so it's predictable and the body knows to produce stomach acid in preparation for a meal. So here are some consequences of low stomach acid. SIBO, small intestinal bacterial overgrowth, this can definitely be a result. Dysbiosis or imbalance of good and bad bacteria. Mineral deficiencies, like I mentioned, B12 deficiency, poor digestion, because if your stomach is not acidic enough, it's not breaking down the food, it's harder for the intestines to do their jobs. Risk for food poisoning, higher amounts of gas, constipation, bloat, and then reflux. So addressing this can definitely help downstream. And as we go through this webinar series and learn more about certain bacteria, learn about the gut-brain connection, these are things to keep in mind because, like I mentioned earlier, it's not as simple as just take a probiotic or take this prebiotic supplement. It starts with the organs that affect digestion, how they're working, and helping to improve the communication pathways throughout the body as well. Okay, so the intestines. Now that we've done the stomach, we're on to the intestines. So your intestines absorb nutrients and water. They house your gut bacteria. They help with neurotransmitter production and electrolyte stability. And this is kind of a repeat, but as a refresher, this is where the metabolic end products like short chain fatty acids are produced. They help to support your sympathetic nervous system. They help to support neurotransmitter release. And when your gut is, when you have bacteria in your gut that eats fiber and produces these short chain fatty acids, it does affect the brain, and these have a huge say in mental health. So here's just a really quick picture on the gut lining. So this is the endothelial lining of the gut. These little villi are really important for digesting and absorbing food. And all of the reasons that I mentioned earlier can affect the gut lining, and these tight junctions of the gut lining cells can break apart, causing a lot of the digestive symptoms that you likely have heard from your clients. So focusing on making sure your clients are getting good nutrition, eating regularly, supporting stomach acid, all these things that we'll continue to talk about can help to improve the endothelial lining of the gut and allow the body to actually digest and absorb the food that they're eating. Okay, so just want to talk real quick about some top causes of a lot of the symptoms that many of your clients experience. So constipation, probably the #1 thing, if you're anything like me and the clients that I've seen. So dehydration, it sounds really simple, but it is probably the #1 reason that most of your clients are constipated. Focusing on adequate water intake is extremely helpful for constipation. And I know that a lot of times clients are restricting water. So if they're restricting water and they're having all these digestive symptoms, explaining to them how this could actually help to improve the symptoms that they're having, feeling really full, feeling really bloated, slowly increasing water. Decreased dietary diversity, as I mentioned earlier, eating fiber helps to improve the bacterial balance in the body. And if your clients are restricting a lot of carbohydrates, especially the ones that have fiber in them, this will reduce the bacterial population and can affect dysbiosis in the gut. Sometimes too much fiber, actually. So if your clients are only eating fruits and vegetables and not including variety of other foods and getting too much fiber, that can make them constipated. And something to keep in mind, as someone increases their fiber intake, they need to increase their water intake because water is needed to push it through. Lack of omega-3s, poor motility, the contraction of the gut muscles, that has to do with the migrating motor complex that we talked about, stress, and then over-exercise. So the relevant ones, I think, to start with your clients, making sure they're drinking enough water, slowly working on increasing variety of food. This can do wonders for digestion. And then decreasing stress and working on balance with exercise if they're at a place where that is appropriate. These things, stress, as far as the connection with the gut-brain connection, this can greatly improve constipation. Okay, gas. So I would say the #1 cause for gas is constipation, and many of your clients are probably constipated and having gas, and it's embarrassing for them. So they probably try to avoid eating in order to avoid being constipated and having gas. And as we talked about earlier, we know why that's not helpful for stomach acid, but ruling out constipation and helping them to improve their constipation first can do wonders for the gas that they're having. And then all these things that I mentioned earlier when I talked about constipation. Bloat, again, #1 reason for bloat in the clients that you're working with is probably constipation. It also could be from low stomach acid. If your clients are having low stomach acid and not breaking down the food, it can lead to a lot of bloat, especially if it's right after a meal. So helping to improve the constipation, focusing on water, looking at stomach acid, getting them to slowly increase the variety of food that they're eating, working on decreasing stress, and then getting that migrating motor complex to move through and clean out the intestines can definitely help with this. And then lastly, diarrhea. So I would say often that, and this is obviously not a universal truth, but in my experience, most of the time when your clients are having diarrhea, it's because they're constipated, and it's something called overflow diarrhea. When you can think of it like your bathtub. If your bathtub drain is full of hair or something is blocking it, it's going to overflow. And that can happen when clients are severely dehydrated, not eating regularly, and not doing all the things that I mentioned for constipation. Their intestines get very full of stool, and they're having diarrhea because their pipes are full. So first, make sure that it's not overflow diarrhea. If they're alternating between diarrhea and constipation, it's likely overflow. I know a lot of our clients tend to rely on diet products that have sugar alcohols. This can also affect diarrhea, and so you would definitely want to check on that. And then dehydration. So a lot of the reasons why someone might be having diarrhea, bloat, constipation, gas is the same. So just checking on all these top things can really make a huge difference in the digestive symptoms that your clients are having, and can do wonders for even just decreasing anxiety around what they're eating. So just to kind of sum it all up, digestion begins when food enters the mouth, and enzymes and bacteria in your saliva help to break this food down. Then food is denatured by hydrochloric acid, enzymes, and the bacteria in your gut and your small and large intestines. And then your intestines produce short-chain fatty acids when there are probiotic bacteria present and they have a feeding frenzy. And these short-chain fatty acids lower the pH of your intestines. They help to balance your sympathetic nervous system support and neurotransmitters. And we'll learn next time why this matters, how it actually works, and how to specifically improve these things. So these have a huge say in mental health, but first focusing on the digestive piece can really make a difference. Working on a lot of the simple things, stress management, getting enough water, slowly increasing diversity in the food that they're eating can make a huge difference. So how does this apply to eating disorder patients? Food is stressful, and stress affects digestion. It decreases stomach acid, and it affects your fight or flight mode, and it can affect how your body processes food. Poor digestion leads to unwanted digestive symptoms, and then these unwanted symptoms cause a really vicious cycle with your patients. They don't want to eat because they don't want to be bloated, they don't want to be constipated, and then what they do to control that makes it worse. They try to avoid carbohydrate foods, or they're only eating a certain small amount of variety of foods, and this limits the amount of bacteria that they have in their gut, and these bacteria can really help them. So breaking this cycle to help them slowly improve their bacterial balance in their gut and improve the digestive symptoms that they're having, so that it doesn't become this really recurring cycle. So we really have to consider this when treating patients with eating disorders. Next up, we are going to be learning specifically about the gut-brain axis, the communication pathways in the body, how they work, and what to do about it as well. So I know we don't have a ton of time for questions. If you have questions, you can send me a message on Instagram. That is my Instagram handle. Tamara can also give you my email address if you have specific questions as well, but I share a lot of gut-brain information over there. Thanks, guys, for being here. I'm going to hand it back over to Tamara.
Thank you, Heather. We have a ton of questions, and so I don't think we'll get to all of them, but we'll try to get through a few, and we will, we can go over time for a few minutes. If folks want to stay on, they're more than welcome to. Can you hear me okay, Heather?
Yeah, I can hear you.
Great. Okay, here we go. We had a number of questions about intermittent fasting and wanting your thoughts on what you think about intermittent fasting.
Yes, I think this was asked last time and I didn't get to answer it, so I'm glad people asked about it. Oddly enough, I actually posted a reel on Instagram about this today, so you can go check it out. I never thought I'd be doing that in my life, but here we are. So intermittent fasting. I am not a proponent of intermittent fasting. I am a proponent of spacing meals out because of how it affects the migrating motor complex. But there's a big difference between having 2 to 3 hours in between meals versus fasting for 16 hours overnight. Especially for female clients, there's not a lot of good research on intermittent fasting. And in fact, the research that we have shows how it negatively affects female hormones. And so I am not a huge fan of intermittent fasting for that reason, as well as just these social reasons. You know, eating a banana at 6:59 is the same as eating a banana at 7:01 p.m. And I think people get in their minds like, I can't eat after 7. But under eating or ignoring hunger as a result of like a time restricted eating window is ultimately worse than anything for your digestive health. So I always tell my clients that too. It is good to space your meals out because it helps with that migrating motor complex. But the golden rule is if you're hungry, you need to eat, because under eating is going to increase stress hormones. And then we know how stress affects digestion. So I hope that simply helps answer that question.
Yeah, that was great. Thank you. Next question. How does one determine if they have low or high acid? It seems most doctors just assume too much acid and prescribe PPI.
Yes, that is true. There's not a super great way to do this. You can go get something called a Heidelberg pH test at your GI doctor. Most people aren't going to do that because it's super expensive and their doctor will probably say no. There is a simple at-home way you can do this. There's not a lot of like great research behind this, but it can be helpful. One, just looking at the symptoms that people have and trialing some hydrochloric acid or like digestive bitters can be really helpful, and seeing if, you know, a week on hydrochloric acid or digestive bitters helps the symptoms. There are people that will recommend doing something called a baking soda test. Again, there's not research about it, but a lot of people will do that. You can Google it and you'll probably find how to do it on there, but that can be another way to look at stomach acid as well.
Thank you. Next question. Would drinking liquids like tea or coffee with sugar constantly throughout the day cause MMC malfunction, or is it just eating solid food too often that would cause MMC malfunction?
Yes, good question. Drinking tea and or like a drink that doesn't have calories wouldn't, but drinking something that has like cream or sugar or something most likely would. I've seen some research showing that like if it's under a certain amount, it won't. But yeah, in general, like anything that has nutritional value to it would.
Thank you. What's an example of a food that provides good fiber for the bacteria in the intestine to feed on?
Yeah. Any food that has fiber, specifically prebiotic fiber. So some examples would be most fruits and vegetables are going to be great, especially things like asparagus and garlic and onions, a lot of the foods that people tend to avoid. And anything also that's a plant. So whole grains would count in this category as well. Nuts and seeds would count in this category also. So there's a huge variety of food that has fiber. So really, I always just tell people anything that is a plant is great. But if you look up prebiotic fiber, and I can provide some information on this as well if you would like. But yes, prebiotic fiber, chia seeds, flax seeds, hemp seeds, all of these are good. A lot of the nuts and other seeds are great as well, fruits and vegetables, and then whole grains too.
Thank you. There were several questions about birth control, Heather. So one was, how does birth control fuel dysbiosis? And others, what type of birth control affect the gut, oral contraceptives, or other hormonal methods? So can you address that a little bit?
Yeah, so this would be like a whole topic in itself. And I will say I'm not anti-birth control at all. Like, I think there's definitely a time and a place for birth control. I think it's just supporting the body if you are on birth control. So birth control depletes a lot of vitamins and minerals that then affect digestion, specifically like magnesium and zinc and vitamin C. And so just supporting the body while on birth control can be really helpful. And then did you say like other birth control methods?
Yeah, they were just asking what types of birth control affect the gut.
Oh, any hormonal birth control.
Got it. Okay.
And actually, copper I can as well, because copper depletes zinc, and zinc is extremely helpful for stomach acid production. So indirectly that could affect it. But yeah, any hormonal birth control.
Okay. If a trigger causes dysbiosis, can the body remedy itself? And if so, how long does it take?
I guess I would want to know what they mean by a trigger. So a lot of things can cause dysbiosis, and it's not like you do one thing and then all of a sudden you have dysbiosis. It's typically a accumulation over time. So maybe high stress for months on end, or a traumatic brain injury, which we'll talk about in another webinar, but a traumatic brain injury, that's kind of one thing that can cause dysbiosis almost immediately, but typically it's going to be like a perfect storm. There's never really an instance where someone has no bad bacteria. You just want the good to outweigh the bad. And typically, especially like specific to eating disorder clients, chronic periods of undereating, chronic periods of restriction, chronic periods of stress, all of that can then couple up to then affecting gut bacterial balance.
Thank you. And one more last question that we have time for today. How does a gastric sleeve procedure affect the vagus nerve?
Oh man.
Yeah, that's just a light little small topic.
Yeah. I don't know specifically because, yeah, there's not a lot of research on that. I imagine that it would affect it some, just with how it affects digestion and absorption. But to be honest, I'm not exactly sure.
Okay. Thank you. That's all right. I appreciate that. Thank you. We had.
I'll look at it. That's interesting.
Yeah, you can throw it in the next one. So thanks for talking about the next in your series. Part 2 is, I'm looking forward to that, and I'm glad you mentioned your Instagram contact information, because I follow you on Instagram and I learn a lot every day. So I would encourage folks to find you on Instagram. Plus, they're a lot of fun. You do a great job. So.
Like I said, I never thought I'd be doing this, but here
we are.
Right,
but that's where our people live, right? So you got to be there, and you're providing really valuable information in a great way. So thank you for that, and thanks for presenting today, Heather. I'm thrilled. We miss you at Center for Change, and you're doing such great work out in the world, and so it's great that I get to see you monthly for the next 3 months after this. So it's wonderful, and we hope everybody can join us for Heather's follow-up in her series. Before we let you go today, just 2 quick things. When the webinar ends, please fill out the evaluation that pops up. As I mentioned earlier, that's a continuing education requirement for us. It's completely confidential, so feel free to be candid in your responses. And then once we get those, we tabulate those and send them back to the CE entities. So if you take 30 seconds to complete that, that'd be great. And then about an hour from now, you will receive a separate email from GoToWebinar with a link in that email to take the online post test. You must take the test online in order to receive credit. And when you pass, the certificate will automatically be downloaded to your computer. If you don't see it right away, look in your downloads file on your computer and it should be there. Thanks again for joining us today. We hope to see you again in a couple weeks for our next one. Until then, be well and take good care.
Thank you.